Is psychiatry a nurse practitioner dominated field? And my answer is I'll be switching in positions for you. Getting in the kitchen and I'm in a better room. I'm gonna need a lip that say I'm coming through. I'm gonna love it, feeling nothing I wouldn't do. I don't know. Hey everyone, welcome back to my channel. My name is Reese, the Psych PA, or Reese, the Resilient PA. Listen here, this is a long overdue video. I promised you guys this video about a couple months ago and I'm just getting to it, but it's okay. It's okay. It's okay. Like a lot of the transitions, a lot of things in life has been going on with me. And so I'm happy to finally be giving you guys this video. This is one of, besides like the resources for psychiatry, this is one of the next most requested videos, the most requested or the most asked question I get over and over and over and over, and it is psychiatry a nurse practitioner dominated field? And my answer is yes, it is a nurse practitioner dominated field. Why? Well, number one, and these are just like my assumptions, psychiatry isn't a field that a lot of people want to go into anyway. So the nurses that already have been working on the psych ward or have psych experience or interested in psychiatry, they go to school, they become a nurse, they get their hours, they go back to school and they specialize, and then they go right back into the field. PAs can specialize in anything. So it's just like, again, there's not a lot of people that's interested in psychiatry until now, but that seems to be shifting. A lot of my mentees, a lot of people who hit me up on Instagram, who follow me or subscribe to me on here, send me messages on Instagram and they're like, yeah, I saw your video on so-and-so, or I saw your shadowing for so-and-so, and I wanted to ask you a couple of questions because I think I might want to go into psychiatry, which is wonderful. Okay, we need all the people we can get, especially after COVID, and I'm saying after like it's gone, but a lot of doctors quit practicing medicine. We had a lot of suicides. I mean, just the impact COVID left on this world is detrimental. All the people that passed away, okay? All the PTSD, not just for doctors, but for nurses, nurse practitioners, PAs, everybody in healthcare, janitorial staff, I mean, the cooks, everybody. It's crazy to believe that we're going on 3 years and we're still in this mess. But I would definitely say yes, those are my assumptions. Then too, on the employer's part, a lot of employers are not familiar with what the difference between nurse practitioners and PAs are. The difference in our training, the difference in what we can do, and state laws. So state laws for PAs is different in all 50 states. In Virginia, I say this all the time, I could prescribe anything. And being in psychiatry, one important medication that I need to prescribe is stimulants because I treat ADHD. And Texas has made it to where I cannot prescribe stimulants in the state of Texas. But in Virginia, I would write for Vyvanse, Folklin, Adderall, Quellbree, Quilichu. It didn't matter. It didn't matter. If I felt like you needed and I ruled out all the other options, or you decided to be treated for anything else we found first and foremost, and you still can't focus, we still have lingering focus issues, okay, fine. Like you've been cooperative, you haven't been combative or argumentative in any way, and you haven't been resistant, you've been compliant with the treatment plan, you've done everything you're supposed to do, I don't mind adding in a little sprinkle of Adderall or a little sprinkle of Concerta. And that's Adderall extended release because I don't do the short actings, you know? But just like knowing the difference between what a PA does and what a nurse practitioner does. Now, are we both mid-levels? Yeah. But there is a difference between us. Nurse practitioners specialize. We don't have to. We're trained in the basis of all medicine. We're trained on the medical model. Nurse practitioners are trained on the nursing model. They do specialize, and depending on what they come out with, like if they're going to go into pediatrics, they go into pediatrics. If they're going to go into adults, they're going to go into adults. If they ever want to switch, they have to go back or get some certification. I don't know. I'm not a nurse practitioner, but that's basically the gist of it, which is kind of similar to a doctor. If they want to switch specialties, they got to go back or do a residency or whatever they have to do. I don't know. I'm not a doctor. But for PAs, fellowships are kind of like residency, and that's optional for us. What we do is we get the basics of all medicine down. We get out, we specialize, and depending on what specialty we get picked or choose, because very seldom do a lot of people get their dream job straight out of PA school. It depends on who's hiring, where the need is, what state you live in, the saturation, like it just depends on where you at. But in all actuality, like it's very seldom that people go straight into what they want to do straight out of school. I lucked up in that area. I got into psych and I ain't leave, and I'm going into my 4th year of practice. I think it's very important to be realistic. Some people start off in the ER because that's the only place hiring at the time. It's very broad. You just took your boards, you know your ish. So why not do it for a little while, and then after a year or two, go into derm or go into wherever. A lot of people want to do dermatology, and I'm just like, I get it. It's attractive. We live in a cosmetic world, but we got other issues that need our attention. For instance, we just had the Roe versus Wade, and I mean, all this foolishness with the abortion, contraceptives, marriage, like it's just the world just seems to be getting worser and worser. And like I just thought after 2020 it couldn't get no worser. Like this, it just couldn't get no worse than that. The world shut down, world stopped, and it still ain't carry on. And so like I just never thought I would see the day that human beings are not treated like human beings. I thought we were past that, and we're not. And other countries look at us like we've lost our mind. We are such an embarrassment, an embarrassment. And I feel very sorry for the people who have been raped, molested, a product of incest, or got pregnant due to incest, and now they're forced to carry these children and hate themselves. And I do automatically believe that it's going to cause suicide. But back to our normal topic. Is psychiatry a nurse practitioner dominated field? Yes. But that is shifting and that is changing, and I've been making more PA psychiatry or psych PA friends on Instagram. It's just a lot of us out here, but a lot of us that it is it's a very small percentage. Like I say, psychiatry is not really, oh yeah, that's sexy type of field. It's more like you have to be called to be in this field. You gotta have the right mindset. You got to be able to talk to people. You got to be a people person. You got to be assertive. You got to be compassionate. Like, it's a lot of traits. You got to be a team player. You got to know how to work well with other disciplines. It's a lot to psych than just treating anxiety and depression, which a lot of people like to define psychiatry as just anxiety and depression. They leave out the psychosis. They leave out the substance abuse. They leave out the trauma and the PTSD. And when they think about PTSD, they only think about our military forces, and they're not the only people with PTSD. They forget the foster care system. They forget a lot of things that go into psych. And I'm just like, if you are thinking about going into psychiatry as an NP or a PA or as a nurse or a receptionist or anybody, you need to know like the whole full range of it. Be very educated on what you're about to get yourself into, and be very patient-centered, because they need you. They're coming to you because they have an issue, and you're there to help them. And even if you don't know how to help them, hopefully you can at least make them smile, at least make their day. That's the least you can do, while you can point them to the right person that can help them. It's a lot that goes into psychiatry, and it's not glamorous by any means, but I love the opportunity I get to treat patients and provide patient education, because much like COVID and everything else out there on the internet, it's misinformation. And people's perceptions are really skewed around psychiatry and what it actually is. And you have an opportunity as a provider, if you decide to go into psychiatry, to make a difference in that department. So I hope I answered your question. Is it dominated by NPs? Yes. I work for a company that I'm the only PA in the office. Why? Because PAs have a hard time trying to get into psychiatry, first of all, because they say, oh, you need 20 years of experience, not to mention you need your CAQ, not to mention you need to have passed your recertification 500 times in order for us to even think about hiring you and giving you, and it's just, I think that what needs to happen is, well, first of all, we need intervention with primary care. All primary cares need to sit down with all the psychiatrists in their area, and we need to talk about medication management, because primary care is the first line, and they usually go through their primary care before they ever get to us. And some people don't want to come see a psychiatrist. They rather keep being treated by their primary care due to the stigma. So if primary care is going to be treating bipolar disorder with Zoloft, we got a problem. I would definitely say we need to sit down with these employers and let them know that PAs are the doctor's right hand. We need to let them know that we can do psychiatry, we can do OBGYN, we can do primary care, urgent care, GI, orthopedics. Like, we can do it all. We're trained in it. And if you've ever seen our boards, or you ever want to know what our training looks like, be my guest to watch some of my older videos. And that's not even the tip of the iceberg. Like, okay. I hope this video helps, guys. I am just getting off of work, as you can see, and I am exhausted. I'm tired. Most days this past month I've been feeling defeated. I will definitely be honest and forthcoming with that, because of the state that the world is in. Not because of anything personal going on, besides my uncle just passed away the other day. But it's just crazy. It's just crazy out here in these streets. So much so that I just want to catch a UFO and just get out of here. Like, it just makes me sick, the type of world we live in. And not even the type of world, but we live in the United States. And to think of what we thought the United States, or the glamour, or the integrity of the United States, and look at what it is now. Like, other countries laugh at us. It's terrible. It's terrible that we can't get along, and that politics seem to rule everything, and it's everybody with these political views, and we can't get nothing done because everybody's not on the same page. And it's just embarrassing to say that we're grown people, and half of those people can be my great grandparents. They all got white hair, they're all old. Like, we need to have young people in politics. They need to really change the age. But I digress. I'm off my soapbox. I hope this video served you. If you're interested at all in hearing anything else about psychiatry, or have any other questions for me, feel free to Instagram me, or DM me on Instagram. And I will also say, these partnerships that I have coming up is geared towards tuition, paying tuition, or having extra money in your pocket during PA school. And if you're interested in hearing more about that, please subscribe to this channel. And please hit that bell notification button, because more content is coming soon. And I see you guys later. Bye, guys.